Now, today's topic is the Health Services Leadership Program, and why don't you just tell us a little bit about how long the program has been in existence and what the goals of the program are?
The Master of Science in Health Services Leadership Program is actually one of the newest graduate programs at St. Vincent College. It just launched last fall. It is a 12-course, 36-credit program, and it is focused towards healthcare professionals. So individuals who have worked in healthcare-related environments and who are either seeking or currently holding a leadership position and are seeking greater education in organizational processes, public policy, and leadership development.
So it's basically a career development program, and this would be something that a student would do while they're continuing in their work?
Yes. It's a very flexible format. Our current students have praised the program for its flexible nature. Students are typically enrolling in 1 or 2 courses in the fall, spring, and or summer semesters. Since it's a 12-course program, that means that they can get done with the program typically in about 3 years.
Mm-hmm. And so what kinds of courses would students typically take in the program?
Initially, they would take courses on U.S. healthcare systems, organization and administrative theory, courses in which they already understand the language of healthcare. And then as they advance through the program, they would start with advanced courses in economics of healthcare, financial administration in healthcare, statistics and research methods. And then the final courses in the program are typically an operational excellence in healthcare course, a strategic management course, and then their directed research project is the final course, the capstone course. Mm-hmm. For the program.
And what could they expect in terms of their career advancement? How do you think it would help them in their work?
The feedback that we've already received from students is that they're taking what they learn in class on a Monday evening and they're applying it back in the work environment on a Tuesday. So that's really rewarding for us from a faculty perspective, from a curriculum perspective, knowing that we've developed a curriculum that is not only focused on educational academic research, but is also very practical to our students in their current career fields. We have also already had students who have received promotions, and they have shared with us that they felt that one of the reasons that they've received the promotions are the language, the skills that they're gathering from the program, so that's also feedback that we'd like to hear.
Mm-hmm. Now the students, I would presume, are also learning from each other because they're all involved in the field.
Absolutely. I'm so glad that you mentioned that point because faculty, we're learning from the colleagues. The average experience of the students in this program are 21 years of experience. Not that all students need to have that level of experience, but great expertise and very broad range of student backgrounds. We have individuals from human resources and marketing, the administrative aspect of healthcare administration. We also have clinical practitioners, nurses, physicians. And then we have specialties, whether it be pharmacy, respiratory therapy, tumor registrars, quality improvement specialists. So it's great that we've been able to attract a really diverse student population to the program. And yes, peer learning is a really important part of the program that we have.
And then how about the faculty? Who are the faculty?
Great faculty. It's such a pleasure and a privilege to be able to work with these individuals. For example, this past semester we had the chair of the pediatrics department and the director of community health at Memorial Medical Center teaching the U.S. healthcare systems course. He just returned actually from a World Health Organization conference in Berlin. So he's bringing the experiences that he's had literally worldwide to our classroom experiences. We have individuals that have not only academic doctoral credentials, but also medical doctor credentials, and they're bringing that experience into the program. We have an individual, a faculty member who has a JD as well as his doctorate and practices in healthcare law and policy. One of our other adjunct faculty members has more than 40 years of experience ranging from hospital environments to long-term care setting environments. So we've really been able to attract a broad range of faculty expertise. In fact, we've not had to do any faculty recruiting at all. We've been really overwhelmed with the inquiries that we've received from professionals and from doctorally qualified professionals wanting to be involved with the program and teaching in the program.
So it's really a benefit to the faculty as well as the students.
Yes, very much so.
Now, are all the classes offered right here on campus?
We do offer all of the classes here at St. Vincent, but we've also developed programs and courses at Latrobe Hospital and Memorial Medical Center in Johnstown. So it's our hope that we can provide all of the courses at those campuses as well, so students would not have to travel to the St. Vincent College campus if it's not convenient. We've also created non-traditional timing of courses. So courses typically take place between 4 and 6:30, so immediately after they get done with their 3 or 3:30 shifts, or we have evening courses from 6:30 to 9 p.m.
Now, for a student who's concerned about the cost of the program, is there any financial assistance available?
Most of the organizations that our current students are working for, actually all of the organizations that our current students are working for, do have financial incentives for them to continue their education. In many cases, they're very generous. So one particular regional employer will cover basically the entire cost of tuition. So it is really important for prospective students to potentially research their own organizations, present to their own organizations the value proposition, the return on the investment that the organization is going to get from the student's education. And the hopes is that the organization will recognize that value and invest in that individual in their education.
Is there anything else about the program that we haven't talked about that you think is important to draw attention to?
One of the greatest joys, I'm not only the program director, but I've also had the privilege now of teaching courses in the program. And one of the greatest joys that we've had in the program is this process of dynamic learning. And my hope and expectation for the program is that so often, especially in healthcare environments, I mean, these are individuals, these are professionals that really work in many of the most challenging environments that exist. And they don't really always have a chance to focus on learning or development or discovery. And so from that perspective, I've also valued the feedback I've had from students that have said, I've never thought about it in that manner. I've never had a chance to consider it from another perspective. And so that's something that I also like to share with potential students, because as much as it's us teaching you skills that you can bring back and utilize in your work, it's also us encouraging and hopefully inspiring you to think differently about how processes can be improved in your organization, how you can grow as a leader and become more effective, and at the same time create an organization that's even more effective at serving the community.